All right, this is a quick video to get you ready for your in-office upper blepharoplasty or your upper eyelids. It's important to stop blood thinning medication like aspirin, ibuprofen, and vitamin E about 2 weeks before your procedure. If you have arnica forte, if you got that in the office, you can start that the night before and take it the day of. If you didn't get it, make sure you go home with it so you can start taking it afterwards to help with bruising. We're going to send in some prescriptions, and it's smart for you, like, really remember this. Bring your prescriptions with you to your procedure, but you can start some of them before you come in. Two Tylenol, 1 or 2 Celebrex based on your age. If you are under 65, you can take 2. If you're over 65, just take 1. There's also going to be an antibiotic that you take, and it's smart to have that Valium working before you come in. So 2 of those Valium are great. When you come in, remember, bring all of your prescriptions. At your procedure, we're going to mark your eyelids out, inject you with some numbing medicine, and we're going to wash you off. So if you come in without makeup on, that's even better. Afterwards, we're going to have some sutures in the upper eyelid, and those are going to come out at about 5 days post-operatively. One of the prescriptions you get is some ophthalmic antibiotic ointment, and you can put a tiny bit on those upper lid incisions 3 times a day. If you keep using it after about 2 to 3 days, some people get really itchy, so that we can then convert to just over-the-counter eye ointment. In your instructions, it's really smart for you to purchase moisturizing eye drops. Those little individual bullets are great right after a procedure because they don't have preservatives in them. So Refresh is a very common brand. It's also important for you to have a gel like Genteel. And most importantly, you want to get an ointment that can go in your eyes and on your stitches after the 2 to 3 days. And that's usually listed as like extreme dry eye, and it says ointment on it. So you definitely want to have those available as well. When you go home, you're going to be elevating and putting some cold compresses on there. You want to wait at least 24 hours to take a shower. Things are going to look really red, and then they're going to get more bruised. It's not uncommon that one side is more bruised than the other. What's super important is if you can't close your eyes all the way because things are tight or numb, you have to really religiously be moisturizing your eyeballs. So if you need to see during the day, you're going to be using drops throughout the day. If you just need a little bit of more aggressive moisturizing, you can use the gel, and that ointment is what's most important for nighttime. So the prescription ointment that you get with your prescriptions is antibiotics that goes on the sutures for just the 2 to 3 days, and then you can switch to the over-the-counter. When we take your stitches out, things are still going to be really fragile. So you always want to make sure that when you're showering or when you're at home, that if you're going to be drying things off, you want to very gently blot. And the most important thing is don't let those eyeballs dry out. We have some scar care that you can start at about 2 weeks, and you're going to continue to keep doing that arnica forte until your bruises go away. Cold is really important at the beginning, but then you can start alternating warm and cold after about 3 or 4 days to help make those bruises go away faster. All right, hopefully that's helpful, and you're going to be all prepared.